Hi, this is Dr. Greg Oliver, and welcome once again to Fat Doctor TV. Today we're going to start our first episode in a series that we'll have over the next month or so on hormones and how they affect your weight. A lot of people, and you may be someone who has said, I just can't lose the weight. No matter what I do, I cut down the calories, I increase my exercise, and I can't lose the weight. The other thing you may be saying is, I'm just tired all the time. It seems like I can't get the energy to focus on staying on a dietary plan, or I don't have the energy to get out and do the exercise, or even get up in the morning early to do the exercise. So a lot of times this may be related to certain hormone imbalances in the body. So today we're going to talk about the thyroid. Now, the thyroid is a gland that sits right here at the base of our neck, and in normal people it can be felt slightly, but the thyroid has several conditions that can occur. And people say, well, what's the purpose of our thyroid? Well, the thyroid produces hormones, and the purposes of the thyroid is to run our body's metabolism. It basically determines the level of metabolism that we have. So think about it. If your metabolism is low, you're more likely not to be able to lose weight. You're going to be tired. You're going to have a lack of energy. If your metabolism is high, if the thyroid levels are high, your heart's going to beat faster, your blood's going to pump faster, you're going to burn up more calories throughout the day. You're just going to be running at a higher level. Now, there is a disease state where your thyroid can be too high. We're not going to focus on that today. We're going to focus on hypothyroidism. That means low thyroid. And about 10% of women will have low thyroid. Lesser men, but we do occasionally see men that have low thyroid. But about 10% of the population of women can have low thyroid. So it's much more prevalent in women than in men. We do check men, however, that come into our dietary plan and programs to make sure that they aren't one of those men that have low thyroid. But certainly we want to look closely at the women because they're more likely to have that. So what are the causes of low thyroid? Well, certainly one of the number one causes is what we call autoimmune causes, where our own body's immune system attacks the thyroid. There can also be viruses that attack the thyroid, and these conditions cause thyroiditis. And if they inflame or damage enough of the thyroid cells, then you'll produce less thyroid hormone. Medical treatments are a common cause. Now, sometimes these medical treatments are very necessary. Say the individual has thyroid nodules or cancers or growths that need to come out. Sometimes the thyroid has to be removed. Or in cases where the thyroid is too high and we can't slow it down with medications, that can be dangerous for the heart and other parts of the body. So you have to treat that, and many times we use radioactive iodine to destroy, or what we call ablate, the thyroid. Once the thyroid's ablated or destroyed or damaged, then you have to take thyroid supplement because your thyroid level will go low. So anything that requires surgery of the thyroid to remove the thyroid or to eliminate the thyroid tissue to protect the body, such as hyperthyroidism, those things can cause ultimately low thyroid conditions. In some cases, it's much more rare, but the pituitary gland, which sits in our brain and tells certain organs how to function, like ovaries in women, testicles in men, and our thyroid. If there's a problem where there's less function of the pituitary gland sending biochemical signals to the thyroid, then certainly you can have low thyroid. And then there are those cases which are kind of unexplained, where the person's thyroid just doesn't function at the level it needs to, and so they remain low in thyroid throughout their life. And it's not that there isn't a cause for that, it's just we haven't picked up the cause or found the cause for that. What are the symptoms of low thyroid? What might you feel like if you have low thyroid? Well, certainly you'd be tired a lot. You also might be weak, feel like, hey, my muscles just don't do what they used to do. The other thing that happens is you may have rapid weight gain or trouble losing weight. So you say, hey, I'm eating less, I haven't increased my diet, and my weight's going up. The other thing you might say is that even when I go on a dietary plan that's lower in calories, it seems like I just can't lose the weight. Things like coarse and dry hair, dry and pale skin, cold intolerance. If everyone in the room is hot and you're cold, that could be an indicator that your thyroid level may be low. Muscle cramps are common. Constipation is also common. Long-standing thyroid levels that are low can lead to depression or depressive symptoms. Also, irritability is a common cause or a common symptom of low thyroid. Memory loss also happens. irregular periods, lower than normal body temperature, and infertility. So these are a broad range of symptoms that can certainly signal hypothyroidism or low thyroid levels. How do we detect it and diagnose it? Through simple blood tests. So if you have these types of symptoms, it would be wise to have your physician draw or your provider draw a blood test looking for low thyroid. Now in our office there are different tests, but the TSH or thyroid stimulating hormone test, known as a TSH test, is very important. The thyroid stimulating hormone comes from the pituitary gland and tells the thyroid how to function. It stimulates our thyroid. If our thyroid level is high, our thyroid stimulating level is low. If our thyroid is low, our thyroid stimulating or TSH level is high. And we'll talk about those particular levels in just a minute. But there are other blood tests too that we do in our office, and that is a total T3, triiodothyronine, there are two hormones, and T4, okay, which is tetraiodothyronine. Those are two thyroid, T3 and T4. We also measure a free T3, which is the active form of the thyroid, and then we sometimes measure a reverse T3, which is an inactive form that some people seem to produce more than others. Now, most doctors will just do the TSH, and that can be a great screen, but if you do have thyroid problems, it may be wise to have further testing done in that realm of number of tests that I mentioned there. So those are the blood tests. Now, with respect to the TSH, normal level is 0.4 up to about 4.5 to 5.0. Now that's a wide range in a normal test. And so what I like to do is, and I can demonstrate, if this is the low thyroid level and this is the high thyroid level, I kind of like to have my patients at a high normal level. So I like to bump them up here. If they're down in this area, they may still have some of the symptoms of low thyroid. So each patient's symptoms have to be taken and evaluated along with their blood test. We just can't do a blood test and say, oh, you're in the normal range, because you may be in the normal range but at the low end of normal and be suffering some of the side effects there. Now, we don't like to push above normal, because what happens there is you can get into some hyper or high thyroid situations. But I like to have my TSH level around 1.0 in my patients, and so we'll treat them until they get to 1.0 and then try to keep them at that level. So that's an important thing to consider. So here's my recommendation. I've told you about thyroid, low thyroid, how it can contribute to a lower metabolism, can contribute to a lot of symptoms, including difficulty losing weight and rapid weight gain. So if you think you're experiencing any of these and having difficulty losing weight, then check with your provider, healthcare provider, or your doctor specifically to get those tests done. And if you have further questions about thyroid disease and how it may affect your weight, feel free to contact us here at Fat Doctor TV. So in future episodes, we're going to talk about other hormone-related issues that can affect weight loss, weight gain, and make it difficult for you to reach your optimal healthy weight. I hope this has been informative today, and look forward to talking to you on further episodes. Again, this is Dr. Greg Oliver with Fat Doctor TV. Have a great day, enjoy the weekend, and we'll see you in the next episode, hopefully a little less in size. Take care.